Everyone right to go? Thanks for joining us here. There are 15 new cases of coronavirus in today's numbers. 8 of those were in quarantine during their entire infectious period. 11 are linked to known outbreaks, and 4, the source of their infection is under investigation. 2 cases are in hospital, 1 in ICU. There were just under 41,000 test results received overnight, so 40,737, which is a very significant number, and we thank each and every one of those Victorians for coming forward and getting tested. We've said it many times because it's true, it is arguably the most powerful contribution that you can make in our collective fight against this virus. If you've got any symptoms at all, please go and get tested and do it without delay. Now today we've got some important announcements to make in relation to the vaccine program. Last Sunday we expanded at 9 state hubs and we made AstraZeneca eligible for everyone between 18 and 39, so over 18s could go and get AstraZeneca. They'd go through a process where an experienced health professional would talk to them about their own medical history and there would be informed consent provided. We've been overwhelmed. Even at just those 9 sites, there's been 10, 12,000 people from that relevant age group, so younger Victorians that have come forward to get their first dose. That's why today we can announce that we aim over the next 5 weeks to get 1 million jabs into 1 million arms, both Pfizer as well as AstraZeneca. That means that AstraZeneca will be available to everybody over 18 at all of our state hubs, all 50 of them. We will expand our drive-through locations. Naomi's going to speak a little bit about Melton and how successful that's been. There'll be 3 more of those, 1 in the west, 1 in the southeast and 1 in the north. This is all about making sure that we get jabs in arms and that all of us play our part in getting to the other side of this. There are 1 million reasons to get the vaccine over the next 5 weeks. We want to break that target, do better than that 1 million jabs. There's every chance we can. And proof of that is the fact that yesterday we had our biggest ever day, 27,427 at Victorian state clinics. That is a fantastic outcome. We need to do just a little bit more than that and we will be able to get 1 million jabs done, 1 million people vaccinated first and second dose. There'll be some of those will be second doses over the course of the next 5 weeks. It is the most important thing to come forward, to get vaccinated, to play your part, to protect not just yourself, but the people that you love the most, and to give us the freedom that all of us want. Getting to 70%, getting to 80%, that's what we have to work towards. And these 1 million jabs over the next 5 weeks are the best way that Victoria can make a contribution, not just to our state's fortunes, but indeed to that national strategy and to the position right across our country. So those 1 million doses between now and Sunday the 19th of September, that is a significant undertaking, but I'm very confident that we'll have that many people go through the program and perhaps more. Some of the hesitancy that people talk about, I think that a lot of it is talk. I think that particularly younger people are very keen to get the best vaccine they can, and the best vaccine they can get, as the Chief Health Officer reminds us, is the one that is available today. So there'll be experienced health professionals to take you through that process at each of our sites. That'll be rolled out in coming days, and throughout the next 5 weeks we'll have AstraZeneca available for everybody everywhere, as well as Pfizer. Naomi can speak about appointments that are not filled yet, but that overall effort of 1 million jabs, 1 million shots in arms over the next 5 weeks, that's our target, that's our aim, and I'm confident that Victorians will continue to come forward strongly to play their part in protecting themselves and their family, but every single family right across our state and our nation. The response since Sunday, when we made those announcements and expanded eligibility for 18-year-old plus, for those people in their 20s and their 30s, has been very, very strong. To have more than 10,000 people through the program already, when it's only been in 9 sites, says to us that there is very strong demand. Can I just send a shout out to people in their 50s and 60s? I don't know that we're necessarily seeing the same level of interest and the same levels of people coming forward and getting their first, and of course their second doses are just as important to complete that process. As the Chief Health Officer says, the best vaccine is the one that's available today. Consult with your GP, or make an appointment and talk to the experienced health professional, whether it be a pharmacist or a very senior nurse or a doctor at one of our state clinics. And if it's safe for you, if it's the best choice for you, then you'll be making a really important contribution to your own safety and that of the people you love the most. But also in a collective sense, you'll be making a powerful contribution on behalf of all of us. We aim to be, by the end of September, at about that 60% mark. We think that with these million doses, if we're able to achieve that or perhaps do better, that's just in state clinics, GP effort, pharmacy effort will be on top of that, then we are well and truly placed to meet our obligations and in fact exceed them. The quicker we get to 70% will mean the quicker we get to 80%, and then we're in a different world, one where hopefully lockdowns are not part of everyday living, where we still have the virus to deal with, particularly amongst those who do not have the jab, but it's a very different world, and there is every reason, if you want to participate fully in hopefully a much, much better 2022, then being vaccinated is an important part of that. Overall, good test result today, good vaccination result as well. These cases that are mystery cases are a concern to us, but this strategy is working in that we are steadily driving down the number of cases and driving up the number of people, the percentage of cases, of those cases who are isolated away, tucked away, no risk to public health. We want to see that trend continue. But any mystery case is a real challenge for us, and I might now ask the Chief Health Officer to speak to those cases and the epidemiology behind them. And then Naomi's got a few things to add to my comments in relation to the vaccine rollout, and then we're happy to take any questions. Getting vaccinated and making one of these appointments, being one of those 1 million Victorians who goes through for a first or a second dose through state clinics over the next 5 weeks is so important. And I think we will meet that target. I think that we'll be quite surprised, all of us, to see perhaps more than 1 million Victorians get the jab over these next 5 weeks. We've opened up eligibility. We're looking at new and innovative ways of making the program easier to access, and it's never been more important to access it and to not delay, not put it off, but to be part of that program and make the appointment as soon as you possibly can. That's how we get past this and into something very different, something that's much closer to normal. I'll now ask Brett to add to my comments.
Thanks, Premier, and good morning. So for today's locally acquired cases, and there are 15, 4 are linked to Altaqua College, 1's a student, and 3 others are household contacts in different households. 2 cases are linked to the City of Hobson's Bay outbreak in Newport. 2 are household contacts, again from 2 different households, and these are from contact with 2 different players who attended the football match that was involved in that cluster. 1 case today is linked to Carolyn Springs Square Shopping Centre, a household contact of a staff member in the shopping centre. So that's 7 cases. Other cases today, 1's a household contact of an existing case in the City of Melbourne outbreak. Yesterday we had a case living in West Brunswick who'd visited the Flemington and Parkville areas during his period of infection. We have 1 household contact of this case who's turned positive. We also reported 3 cases from 2 separate households in Glenroy yesterday, and today we can report 2 related cases at Glenroy West Primary School, 1 student and 1 household contact. In addition, there's 1 household contact of one of yesterday's Glenroy cases who's a student at another primary school, and we'll provide details of that when the school's been contacted this afternoon. So that's 12 cases. And then there are these 3 so far unlinked cases. 1 case lives in Wyndham Vale and works as a delivery truck driver. That's a exclusively state-based truck driver, not an interstate driver. There are a number of exposure sites in Werribee that have been generated, so please check the website for those details. Another case lives in Roxburgh Park and works in Bundoora. There is a link to one of the school communities that's being investigated now, so we'll be able to hopefully link that and provide updates tomorrow. And 1 case lives in Middle Park. This is still under investigation. A number of exposure sites generated across Middle Park, South Melbourne and surrounding areas. So that's 15 cases in total today. And those mystery cases, as the Premier said, are a particular concern. These are individuals who don't know that they're infectious at a time. They've developed symptoms, they've gotten tested and done the right thing. They're now isolating, and their primary close contacts are being followed up, but they've been out in the community within the restrictions that are imposed in the lockdown, but still shopping for food, going out for essential reasons. So those exposure sites are quite numerable because that individual wasn't already identified as a primary close contact. That's the challenge of mystery cases. That's why we need to get on top of them as much as possible. The thing that will identify those links as early as possible are people getting tested with the earliest of symptoms and the mildest of symptoms. So we're looking at all possible linkages, schools, local sites visited in that acquisition period of the 14 days before symptom onset, and any workplace connections for those attending on-site work. We've had continued high demand for testing in Melton, which is fantastic. A new Melton Drivethrough site is operating from 9 a.m. to 8 p.m. today, and then 8 a.m. to 8 p.m. on the weekend. So please access that. That's at Melton Football and Netball Club in Toolern Vale. We've also been advised of 4 new unexpected wastewater detections in Metro Melbourne and in regional Victoria. That includes Lakes Entrance, Camberwell Balwyn, which has kind of pinged on and off over recent days, and 2 catchments in the western suburbs, including Tarneet, Truganina and Williams Landing. So, as we always say, any symptoms, please get tested, but in particular in these catchments, bear in mind there could well be a case in these catchments. It could be you. You need to get tested if you have any symptoms at all. On vaccination, as the Premier has thankfully repeated, the best vaccine to get is the one that you can get now. We've seen a lot of young Victorians turn out in their thousands with AstraZeneca available through our state-based hubs, 18 to 39-year-olds. That's fantastic. Monday to Thursday last week saw more than 18,000 AZ doses given at state-run sites. This week, over the same 4 days, 31,000 AZ doses given. So a really significant uptick there. We do need Victorians of all ages to look at that stepping up and kind of reflect the enthusiasm for people coming forward for vaccines, especially as the threat in Australia is probably greater than at any point since March of last year. A huge thank you to the doctors, the nurses, nurse immunisers, pharmacists and other immunisers across Victoria who've helped more than 2.5 million people get their vaccine, their first dose. Doctors and pharmacists play a key role in delivering vaccines in Victoria. More than 1.9 have been delivered through doctors, respiratory clinics and community health services. That includes more than 1.5 million doses of AstraZeneca, more than 390,000 doses of Pfizer vaccine. So we absolutely encourage people to speak to a doctor, pharmacist or a senior and experienced immuniser at our state-run clinics if they have any questions, any concerns about the COVID-19 vaccine. The AstraZeneca advice has changed over time. Look at it, consider it for your particular circumstances and make a judgment. No one's being coerced, no one's being unreasonably pushed here. We've opened up the operational availability of vaccines, but that decision-making is with you and a trusted health professional to advise. The evidence is clear, however. Vaccinations will decrease your chance of getting serious illness, getting hospitalised or dying. So your vaccination will make a difference for you, for those around you, for the entire Victorian community. The more people vaccinated, the better protected we will all be. I'll now invite Naomi Bromley, head of our vaccination program, to explain more. Thank you.
Thank you, Brett. This week, Victorians have proven again that they're willing to come forward and get vaccinated. We've had over 100,000 doses administered in our state-run clinics since Monday this week, and yesterday, as the Premier said, we had our busiest day with over 27,000 doses administered since the start of the program. Our GPs and pharmacists are also continuing to scale up all across the state, and I really encourage people in particular, keep an eye out for pharmacies in your local area who will be coming online in the coming weeks, and more GPs who are now able to administer Pfizer. Like Brett, I want to extend a huge thank you to all of the staff in our vaccination system. Doctors, nurses, pharmacists, paramedics, nursing and medical staff, the admin staff, the security staff, the traffic controllers, you are all doing a fantastic job and you have our gratitude. Capacity is now being scaled up all across the state-run system. There'll be more drive-through, more mobile clinics, so we can administer the 1 million doses in the next 5 weeks. We've seen a really great response to Victoria's first drive-through site that we announced on Sunday. The Melton drive-through site has successfully administered 900 doses this week so far. It's all gone really smoothly and the staff out there have been doing a fantastic job. We know it's been really popular in that local community and we're continuing to see a lot of bookings flowing through. I am really pleased to share that we are looking at planning 3 additional drive-through sites. So they'll be in Wyndham, up in the Hume-Whittlesea area, and then down in the southeast in Casey or Cardinia. We are looking forward to providing more details about those very soon. Now, these are sites that are going to be established in partnerships with local communities, local government and industry groups. And as the program continues to roll out, these types of partnerships are going to become increasingly important. Now, there are close to 275,000 vaccine appointments available in our state system over the next 4 weeks right now. Every single day, we're putting more and more appointments into the system. So if you haven't booked your appointment yet, it is time to jump on and have a look for one of those appointments. It's time to come forward as quickly as possible. I was really pleased this morning to wake up and find that we had exceeded all of our previous targets and done those 27,000 doses yesterday. But I was even more pleased to see that 94,000 Victorians in the past 24 hours have jumped on our system, found themselves an appointment and booked in for a vaccine in the coming weeks. Thanks. Question?
Sure. When will the other hubs be open for AstraZeneca?
So as the Premier said, all of our state-run hubs will now be providing, from Monday, will be providing AstraZeneca to 18 to 39-year-olds. So any state hub that's currently administering AstraZeneca, from Monday, open to 18 to 39-year-olds, all across the state, regional, metro.
How long do you think it's going to take to get these drive-through clinics up and running?
I'm really hopeful that we'll get the first 1 or 2 locked in this week, in the coming days, and then possibly even opening as soon as next week, but we just need to work through some of those details, but it will be certainly in the next couple of weeks.
Are there logistics issues because people need to wait for a certain amount of time after the injection? How's that going to work in a drive-through hub?
You do need a big physical space to run a drive-through. That's absolutely true, but it's not unsolvable with the right space and the right layout. So the setup out at Melton is really good. There have been a lot of efficiencies that have been identified this week. So the amount of time that it took to kind of bring the car forward, administer the dose, do the waiting period on Sunday when we first started has been cut down and I think actually even halved over the course of this week. So all of those learnings, and the team at Western Health have just done an amazing job there this week, all of those learnings will be taken forward as we plan these new sites, so they will be really efficient.
Do you have any clearer indication of when Pfizer will be available to that age group as well?
Nothing that we can announce at the moment, so obviously we continue to align with the Commonwealth program, and that will essentially continue to be supply dependent as it has been up until now.
Based on those million vaccines that you want to give, how many of them as a proportion will be Pfizer versus AstraZeneca based on your modelling?
So at the moment in the system we do about 2/3 Pfizer and about 1/3 AstraZeneca, but what we expect to see over coming weeks, and we've already started to see this week, is that balance will shift and we'll probably get to a point where we're administering similar amounts of Pfizer and AstraZeneca, but probably around about that time we'll also start to see more Pfizer coming online, so it might start to shift again. It's really quite dynamic. It does sort of change week to week depending on what's happening.
Are we expecting a Pfizer boost in these 5 weeks, and do you know how many doses that is?
Well, we're actually seeing the Pfizer boost now. So if you remember a few days ago we talked about the Commonwealth bringing forward 150,000 doses of Pfizer from our September allocation into August. Those doses are starting to arrive from today, actually, and so we are pushing those appointments into the system. Of course, keeping aside the doses, the second doses, but pushing those appointments into the system. And again, if you remember back a couple of weeks, when we changed that Pfizer dose interval from 3 to 6 weeks, that also allowed us to essentially free up or bring forward around about 130 additional doses. So the reason that we're able to put in so many of these appointments in these coming weeks is because of AstraZeneca and opening up that availability, but it is actually also because we have on both of those counts, the Commonwealth bring forward and the changing that administration period has allowed us to essentially free up more Pfizer first doses. We're pushing those into the system, and the increase that we're seeing and being able to hit that 27,000 yesterday, there was absolutely a contribution from AstraZeneca, but also a really important boost in the Pfizer first dose numbers that we're seeing coming through.
Are we on track with the Commonwealth's rollout? Have we finished 1B, or is there going to be a lag for younger people?
No, I think we're on track. I mean, I think that the way that the program was laid out, very, very early on in the year with, there were several sort of phases and different cohorts associated with them. I think the way that the Commonwealth is now articulating their plan in the COVID Shield plan is slightly different, and it really will transition now to more of an age-based approach for the whole country.
Are we at the point now where you can guarantee the supply and therefore make these hard targets, or is supply still a bit iffy?
So when we get the information from the Commonwealth about supply, and we usually have supply certainty 4 weeks in advance, that's the information we use to push in our appointments. And of course, then we use the Horizons document, which is publicly available, to plan out our period beyond that. So all of the supply information is essentially publicly available, and that's what we use to put our appointments in place.
According to the federal document yesterday, people over the age of 40 to 50 are still around 55%, just a bit above when it comes to first dose. Brett Sutton mentioned them as a bit of a shout out, a call to arms to come forward. Why is that so low? Is that a supply issue, or again, are there still free appointments for them that are just not being taken up?
I think it may be a little bit of both, actually. So we know that we're sort of coming out of this period where appointments have been very, very constrained. But we are now, and this is our key message, we're entering a new period in the program. There are appointments available. So for people in those age groups who have been eligible for some time, my message is clear. Jump online, book an appointment, call the call centre. This is the time when there are appointments available. Remember, I said there are 275,000 appointments in the system, and my team are literally putting new appointments in every single day. Now's the time to jump on and book yourself an appointment.
Some of the vaccine hubs out in the West have had to suspend walk-ins because of certain social distancing issues or the demand they've had with the bookings they've had. Because of this target you're setting now and and whatever modelling you've done, do you anticipate that having to occur elsewhere?
Yeah. So for many months now, we've only allowed walk-ins for AstraZeneca, not for Pfizer. The message is booking in is better. So walk-ins is something that we can do when the system allows it, and as long as it's safe and appropriate to do so. We won't allow our vaccine sites to become unsafe, particularly in an environment where we have got community transmission. So I really encourage people to book in. It's very, very easy now. There's an online booking system. It just takes a few minutes, and the call centre is also available. Very low wait times for the call centre. You are better off jumping on and booking in rather than trying your luck to walk up. I really encourage that. Now, walk-ups are really popular. We know this from May when we opened up a lot of walk-in capacity in the system. I'm not saying that we won't do that again in the future. It plays a really important role, and we know for some people there's something really attractive about the idea of walking up, even if they might have to wait for a while. I think the best thing for people to do now is to try and book an appointment rather than try your luck walking up.
And will other health providers maybe take some of the walk-up capacity now? If you're trying to push bookings, would you encourage pharmacists to be more available for walk-ups as they've started doing this week?
I think pharmacists do require a booking for obvious reasons. In that, some might, but I think by and large the pharmacy model is more of a booking model for obvious reasons that you don't want a whole lot of people congregating in a pharmacy.
Some people with bookings yesterday at the Royal Showgrounds had to wait 3 hours. I'm not saying that it's not worth it, but is there any way you can streamline that? Is that because of the walk-ins, or can you separate them from the people with bookings?
Absolutely. So part of the work that we're doing with this system as we roll this scale up out is to reinstate all of the really good queue management protocols that we had in place. If you remember, again, back to May when we were really busy. So we've started that work with the health services this week. There are best practice guidelines around queue management. Separating people who are booked and people who are walking up is absolutely part of that. So we'll make sure that those processes are as smooth and streamlined as possible as the system scales up.
We heard before that there's 55% of people in their 40s to 50 who have got vaccinated, so 45% who hasn't. How do you get people who are that age or a bit older to actually turn up and get their vaccine beyond kind of standing up at a conference and saying, please come and do it?
Do you want to?
Well, Michael, you'll see a campaign launched, lots of TV ads, all platforms used. There literally are a million reasons to get vaccinated, whether it's for your job or somebody else's job, your health or someone else's health. So you can go to the MCG and watch your team win. So you can spend time with your grandkids, so you can travel around the country, travel around the world. There is a million reasons. That's why we're talking about 1 million jabs in arms over the next 5 weeks. There'll be not just us standing here at press conferences, every platform will be used, and we'll be grateful to you if you can get that message out also. People can book with confidence. There are literally hundreds of thousands of additional appointments. They're open, they're in the system. If you book, then you will be able to turn up and get your jab and play your part. And even if you're not interested in anybody else, you can protect yourself. I think that most people want to do the right thing, not just by their family, but by every single family. And it's been so impressive and so pleasing this week to see so many people come forward after we expanded the eligibility last Sunday. So it's only a few days ago that we allowed AstraZeneca in 9 clinics for 18 to 39-year-olds. We've been very encouraged by literally tens of thousands of young people coming forward. Today's shout out again is to them, but it's also to people in their 50s and 60s. Talk to your GP or make a booking, come to a state clinic, talk to an experienced health professional, and then if you are in the position to give informed consent, you can, and you can book with confidence and get your first and second doses with confidence and be able to play your part.
How much is this campaign costing the government?
I'm not sure. Frankly, a tiny fraction of the benefit, I would think.
And you mentioned
we have a standing by. Sometimes it's about testing, sometimes it's about getting vaccinated, sometimes it's about applying for business support. We've got space booked, if you like, and we can move in and out depending on what is topical that week, that month.
Just on the campaign, you mentioned on Twitter that you got vaccinated for your mum.
Yes.
Can you talk a bit more about that?
Well, look, I can't go and visit her at the moment because I live in Melbourne and she doesn't. But there's lots of different reasons, and I've got vaccinated not just for my own health, but so that I can spend time with the people that I love the most, whether that's my kids or my mum. It is a powerful contribution that I can make, that every Victorian can make, regardless of who you are, what you do for a living, where you're from, what your circumstances are. There'll be literally 1 million reasons to get a jab over the next month. But if we can reach that target, then we will be really well placed to be in a situation where there's not lockdowns anymore, where the rules are very different, very, very different, and where we can look with a sense of optimism and purpose and confidence to the new year, to 2022, and know with certainty that we have beaten this thing. But we just won't get to that point unless, for the most personal of reasons, or in the broadest context, for your family and every family, make a booking, come forward, get the jab, play your part. That's what's most important. And the key point today, you can book with confidence. Those appointments are open, that supply is there, and if we reach that target, then we'll be really well placed to meet the next target and the one after that.
With National Cabinet today, what's the message that you're going to be bringing to the New South Wales Premier in regards to their decision to give people of New South Wales more freedoms when they hit 50% vaccination, which is not in line with the national way of doing things?
Well, I think there's a lot written and a lot said about this. I think every government in the country has signed up. In fact, I know, because they have. Every government has signed up to the national plan. Whether some restrictions can be eased in Sydney at a point in time, that's a matter for the New South Wales government. Nothing that's been said or done gives me any cause for concern. That is to say, the Premier of New South Wales last Friday signed up to the national plan, re-signed up to it again. I think that there's a lot of people are assuming many things. I think rules can change. That doesn't mean that you've opened up. It doesn't mean that a lockdown is over. Beyond that, I'm not here as a spokesperson for the New South Wales government. I'll leave it to Gladys to explain what it is she wants to do. But I'm not concerned. I don't think that there's a New South Wales gets to 50% and they throw the doors open and their lockdown is over. I just remind everybody that the Doherty modelling is not based on hundreds of cases every day. It's based on having a very small amount of virus, if any, in the Victorian or the Australian context. That's when you get to 70% with very low case numbers and 80% with very low case numbers, you have many options. Sadly, when you've got thousands of active cases and hundreds of cases every day, you don't have those options. You just don't. That's why Melbourne's locked down, because we don't want to get to a point where we have hundreds and hundreds of cases. We want to keep driving these numbers down, and to see 11 or more, to see a significant percentage of our new cases today tucked away, no risk to public health, isolated 100% of their infectious period, that's the trend that we want to see continue.
But given the caseload there, the way things are tracking, opening up further could only lead cases to grow further there. Given that we share a border with New South Wales,
yes,
and this is something that is going to impact Victoria for the months to come, what is going to be your message? Are you going to be putting forward Victoria's point of view on this?
People well understand Victoria's point of view, and that is we're very strong supporters of the national plan, and that is that we don't open up until we get to 70 and then 80. Rules can change though. I'm confident that the New South Wales government, like all of my colleagues, follow health advice, and you wouldn't get health advice at any point that said open slather at 50% with thousands of cases. That would be a recipe for absolute disaster. I am just making the point that I don't think that's on the table. I think that you're putting to me a set of scenarios that are not actually real. I don't think that's going to happen, because I take the New South Wales Premier for the comments she's made. She's an enthusiastic supporter of the plan. Doesn't mean that rules can't change. So I'm not quite as concerned as others about what's happening there. What I think we're all concerned though, and if we can help out, we're always ready to do that. What's concerning is not so much rules that might change in Sydney in a month's time, but the fact that there's nearly 400 cases today, and lots of people in hospital, and sadly some people, very young people, who are losing their lives.
And also, Premier, you've said previously that when all Victorians are offered a vaccination, you'll be comfortable to leave lockdowns and to not make that a key part of our health response. Do you stand by those comments, given the outbreak in New South Wales at the moment?
Well, I stand by the national plan that we had quite a bit to do with writing and drafting. We've made a very significant effort to be an active part of that process, and we've been commissioned to do some further work together with Tasmania and the Northern Territory around vaccine passports and what being vaccinated means for your freedom, and what not being vaccinated might mean from a rules point of view as we look to the future. I've been very clear. I want to offer it's what I've sort of said, Julia, if I can reconfirm this. It's really tough to be kind of talking to people about how they must get vaccinated and all the consequences of not getting vaccinated when there isn't enough supply. That's going to shift though, and then supply will no longer be a barrier. In other words, everyone will have been able to participate in that Commonwealth vaccine program. Today's announcements, those additional appointments, that target of 1 million jabs over the next 5 weeks, that's a step towards everybody being offered what we want them to take up. The other document that's important, the other wording that's important, is the agreement that all governments, state and federal, have reached around the rules that are applicable at 70% and the rules that are applicable at 80%. That's the most contemporary document, but I certainly stand by it. If we get to 80%, then the rules change, the game changes. It's a very different set of circumstances, a different challenge. But we won't stop at 80. We want to go as high as we possibly can, because to be unvaccinated once we open up will be a really dangerous place to be. Look at Florida, look at Texas, look at so many parts of the world where there is a second pandemic, a third, fourth, fifth wave amongst the unvaccinated, and they are getting terribly ill. That means we've got to work really hard to get as many people vaccinated as possible, because Delta spreads fast and no one wants to get Delta.
Premier, in your campaign, in terms of communications, and
Yes.
given where a lot of the infections are happening currently, and we know for a fact there's a certain level of hesitancy in ethnic communities, will you be actually rolling out a campaign beyond talking to leaders? I mean, actually a communications campaign through media and others in ethnic media?
Yeah, we'll be across all platforms, as I said before. So there'll be multicultural print, news, online, radio, TV, the works. Every platform we can find, every mechanism we can find, including word of mouth. You know, as people get vaccinated, going and telling all your friends and family that you got vaccinated, helping mum or dad or grandma or grandpa to make an appointment is incredibly important. Making an appointment for yourself is very important. So you can rest assured we know and understand that this is a brilliantly diverse community, and that means we have to communicate in lots of different ways. And I think we've got a pretty strong track record of doing
Is the
that.
state government having to do this because the federal government is not doing enough in the advertising space?
No, we always reserve the right to talk to our Victorian community and to call upon them to do things or not do things, as the case may be. And you know, there's a lot written and a lot said about doing research to understand what the community thinks and wants, spending money to speak with the community, to listen to the community. This is exactly why you do that work, so that you can get people in a program, make sure they've got confidence in a program, and make sure that they get vaccinated. That really changes life for all of us, saves lives and changes life for all of us. That's what getting vaccinated does.
Sorry, Premier, you said that...
Will you be raising the issue of border permit enforcement? Obviously, we had the 2 women flying from Sydney. Qantas has come out and said that their staff aren't trained to enforce these permits. So will you raise possibly options of
Well, if I've got to put
force?
authorised officers up at Sydney Airport, for instance, to stop people getting on planes, I'll do that. I would have thought that Qantas airlines might be able to play that role for us, but I don't know that that's a National Cabinet issue. But we can't have people who have no valid documents. They don't have that passport. They don't have that permit to come to Victoria. They are, and you know, we've seen a lot of commentary about our permit system. Well, gee, it served us well to the point where we have found people who are actually positive with this virus travelling on bogus permits. We need to go further than that, and if we need to, we will. I don't know that that's a National Cabinet issue. That might just be us having to do even more. We never rule that out.
On your point just now, do you have jurisdiction?
You need to work out which of you is going to ask the question, and then I'll work out how I answer each of them. That's the best there. We'll split the difference.
I'll ask the next one.
Just to clarify, so you would consider sending authorised officers up to Sydney Airport?
Well, I would not. I don't want to have to do that, but there are permits, and you know, the other thing too is maybe we can train some people at Qantas to do this important work, because the alternative is they turn up here and we turn them around and we send them back. Now that means they're on 2 flights instead of 1. They're in airports. They're a risk. It's much better if they're not making that journey, because they're not permitted by law to make that journey. I don't know that this will necessarily be on the National Cabinet agenda, but you know, we'll work with other states. We'll try and be as cooperative as we can. But if you haven't got a permit, don't come here, because the best you'll do is spend a few nights in hotel quarantine, and then you'll be sent home.
Has the state government actually got any
airlines to essentially function as government and keep our borders safe?
Well, look, I'm not here today to have a crack at airlines, but I think airlines have been pretty generously supported by taxpayers, and it wouldn't be too much to ask them to check whether someone's got a permit or not. But in any event, I'm not here for an argument with them, but you know, I don't think they'd be at the front of the queue for people that could have a whinge. They've been pretty well supported.
Premier, talking about support for business, I mean, I've got case studies of numbers and numbers of businesses in the ethnic communities, not only just Greek, across Indians, that are the back's up against the wall. But will you be taking something to National Cabinet for a more coordinated response to that? I mean, in the second week, there's at least 9 cases where they're almost about to collapse and going to...
Well, we've made some announcements about rent relief. We've made some announcements about supporting landlords so that they can comply with the changes that have been introduced into the Parliament. So that's a resumption of some of the rent relief measures we had last year. Just this week, just yesterday, in fact, Minister Pakula made some announcements, again, a partnership with the Commonwealth Government, the best part of another $360, $370 million out the door, paid automatically with some changes to the way that system works. It's not just more of the same, although some of it is that way, but there are some changes to that package because we've listened to a number of different industries, a number of different businesses who've said, look, we need the package to be a little bit different to meet the needs that we're facing now. We certainly don't rule out doing more. In fact, I think we've shown very clearly over these last few months, and indeed beyond that, that we're prepared to support business. Very significant grants, paid out automatically, dealing with some of those backlog issues. Just this week we've made announcements. If we have to do more, then we will.
Ryan said yesterday he had no idea why these women were coming down to Victoria. Do we have any more detail?
No, we don't.
Do we know what their
Back to your point.
relationship is?
Sorry?
Do we know what their relationship is?
No, I don't have much detail on them at all,
Just
other than that
sorry.
they weren't supposed to be here and they've been fined.
On this point, sorry, you said before that you could send authorised officers up to Sydney Airport. Does the state government have any jurisdiction to be able to do that?
Well, again, we'll do whatever we can. There's a lot of different options, but I'd rather not have Victorian staff working in New South Wales. And yes, you're right, they may not necessarily have all the authority that they might need. But again, all of us need to work together. They don't have a permit, but the problem is the planes don't stop at Albury. They stop in Melbourne. And the way to solve this perhaps is, if you haven't got a permit, don't travel here, because the best you'll do is spend a couple of nights in hotel quarantine and then you will be sent home. And you would literally have to be, like, I don't accept that anybody is unaware of the permit system. It's operated for months and months and months. If we can get some sort of a partnership, a different partnership between our government, airlines, airports, then of course we would be only too happy with that. And of course we'd play our part as well. If the South Australians asked us to play a role in not allowing people who weren't permitted to travel to South Australia, then surely we could all work together. Whether that's something that National Cabinet has a position on or whether it's done bilaterally or multilaterally, well, we'll just have to see how that unfolds.
Could you ask the ADF to do it?
Well, I'd never rule out asking anyone to help us out. We've got lots of people working with us. But again, these are state permits, they're not national permits. And there might be some around the National Cabinet table who don't think there should be permits, that there should be complete freedom of movement. I don't think that'd be a very good idea, given the number of cases we see in some parts of the country.
Is there a better balance to be struck here, though? Because there's that publicised case of a family member who couldn't come to support someone going through chemo. So obviously the rules are strict for New South Wales for a good reason, but is it too tough and pushing people to try to sneak in and perhaps be missed by Victorian authorities?
No, I don't think these two people were coming here for compassionate reasons. And in fact, what they might have done is caused enormous inconvenience to the rest of that plane load of people who were coming here with valid permits for compassionate reasons. So, a pretty selfish thing to do. They've been fined, and we won't hesitate to fine anybody else who similarly thinks that the rules don't apply to them. We can work through, whether there's different ways of doing things, whether there's different processes, who checks who and all of those things and where. I would just say that's two cases amongst many, many thousands of permits that have been issued. It's two cases among many thousands of people who've arrived at Melbourne Airport. We'll just, every day we have to look at things and maybe doing them differently, because the challenge doesn't stay static. The virus isn't static.
But Premier, those are possibly the only cases that have been caught. So in a time when there's an increased COVID risk, why is there not a red flag going off in that permit system when someone goes to apply for a green zone permit from an extreme risk zone? Why was that not picked up in our system?
Well, they didn't have a green zone permit.
We were told yesterday that these women had a green zone permit.
Well, in any event...
was it a green zone permit? Did they not have a permit?
I need to come back to you on exactly what you were told yesterday. I didn't necessarily tune into every minute of what you were told yesterday.
We were told it was a green zone permit.
Well, again, I don't know that this is necessarily the point of the discussion today. We don't want people coming here that don't have a valid permit. And if you're from Sydney, pretending that you aren't, or pretending that you've got a green zone permit when you don't, doesn't do you any good, doesn't do anybody any good.
But if it was invalid, how were they able to apply for it in the first place?
Again, I don't necessarily have the details of that. I'm happy to come back to you about what they did and didn't apply for. They did not have a valid permit, and they've been fined because they did not have a valid. I don't believe that it was a system problem, is what I'm really saying to you. I think that they have travelled with documentation that is not legitimate. They've been fined on that basis, as for further details, what they did and didn't apply for and how they interacted with the system, I'm more than happy to have someone come back to you.
Sorry, Premier, just coming back to today, 400 exposure sites, another consecutive day of mystery cases.
Yes.
How confident are you that we can get a handle on these outbreaks?
Well, look, we all have to work as hard as we can to run each of these cases to ground, the contribution that each of us makes, getting tested, following the rules, getting vaccinated, taking up one of those literally hundreds of thousands of extra appointments that we've announced today. All of those contributions make a massive difference. What we all know is that we could not open yesterday, we couldn't open last night, we had to extend. And if we don't want to extend again, if we want to make it more likely, not certain by any means, but more likely that this can be over sooner rather than later, then we just have to all play our part. And that means looking at the website, checking if we were anywhere near those exposure sites, getting tested the moment we register symptoms, being really careful and really proactive in following those rules. Not just the spirit of them, but following them for the reasons they're there, and that is to drive case numbers down and get us open and keep us open.
Is that on the table, extending again?
Sorry?
Is that on the table, looking like...
We look at these matters every single day. I've got no announcements to make about that at all. Don't read into that it's more or less likely. It's one of those things that is assessed every single day based on case numbers, based on the stories and the facts that sit behind each of those cases. Not just quantity, but, were people out in the community? Do we know where they got it from? Are they mystery cases or otherwise? Are they linked cases? All of those things. There's nothing new in that. That's driven us every day for the last 18 months, and it will continue to.
Premier, in terms of
until we get 80+% of people through the vaccination program.
In terms of the vaccination target, 5 weeks takes us halfway through the final series. I know it's not the focus, but is any part of this going
No, footy's a big focus for a lot of people. A lot of people. We're not. No, look, it's too early for us to say what major events will be held in Melbourne and Victoria. Just like I think it's probably too early for anybody in Sydney to be talking about these things. We just have to wait and see how things unfold. I want to see footy back at the G. I want to see crowds there as well. But we just have to, and big crowds if we can, but it's just a matter of doing what's safe, following the advice, and making sure that none of us are doing anything that might contribute to us being locked down for longer or more people in hospital. This is this kind of limbo period where until we get people vaccinated, we're going to have to continue to have a very low tolerance for cases because Delta spreads so fast. That's why these million additional jabs over the next 5 weeks, hundreds of thousands of extra appointments into the system, more drive-throughs, AstraZeneca available at all of our sites, not just the 9 that we announced on Sunday. This is how we get to the other side of this, and it's how we get to 70 and then 80%. And then the rules are very different once we get there.
So it's 80%'s the low tolerance for rules. Is there any reward when we hit 60%, the target you set about September?
No, I think 60% is just we're a step closer to 70%. The plan is very clear and the Doherty modelling is very clear. If you went, and it's not everything at 70% either. It's some things can be done differently. It's not until you get to 80% that you can, as a minimum, and we want to get higher than that. If we can get to every percentage above 80%, obviously, that's less people who will finish up gravely ill as the Delta variant spread, or whatever variant comes next, spreads around the people who have not been through the vaccine program.
Just on those targets, you said that the Doherty Institute modelling was based on very small case numbers. So does the outbreak...
Certainly not hundreds of cases a day.
So does the outbreak in Sydney then threaten those targets, 70 and 80%?
No, but I think the outbreak in Sydney means we're smart to have our border closed, as difficult as that is. The virus travels with people, and have a look at a map of New South Wales today. This started in Bondi. It's not in Bondi anymore. It's everywhere. It's right across New South Wales. We've got to try and prevent it coming to Melbourne, and that's why we'll do whatever we can to do that. And that means you've got to make some incredibly difficult choices. I don't like to think that senior officials are making decisions to deny people who've got compassionate grounds to come here. As I said yesterday or the day before, I don't like locking Victorians out of their state, and I don't like locking Melburnians into their homes. I don't enjoy that. I don't like that. But there's no choice until we get people vaccinated.
Just on the alternative quarantine hub up at Mickleham, there was a community forum that DPC held last night, and an official told the forum that it wasn't an option for the community to say no to this project, and that Mickleham was only one of a small amount of land big enough to have this site. Why not give Mickleham locals some chance to have their say in this project?
Well, let's be clear about this. This is Commonwealth land, so the Victorian planning scheme does not apply to it. So it is.
But it was your idea at the start of the year, though, wasn't it?
No, hang on. This is Commonwealth land. Victorian planning laws do not apply to this piece of land. There's already a biosecurity facility there. I don't know how much consultation there was in the local community when that was set up. I don't actually know when the federal government set that up. This is something that is incredibly important. It'll be built to the highest of standards. It's on an existing, if you like, a site that already deals with a number of risks to extend and make best use of the infrastructure that's there already. Makes perfect sense. We want the community to know what's going on there. We want the community to be part of that program and that process. But we've got to get this built. There's much greater risks to people across Victoria, Mickleham included, by having thousands of people in hotels that are not built to quarantine them. What is much better is a purpose-built facility for the people of Mickleham and all Victorians, built in Mickleham or wherever it's built, but that's the site that's been chosen, and everybody, including locals, will be better off because of that.
Can I ask about the border bubble permits
Sure.
that come into can be enforced from today?
Yep.
Do you need to essentially fill out a new permit for every single time you want to cross?
They've got a 2-week life, as I understand it. Let me get the exact wording for you. We'll make sure that,
what
everyone's
about
clear on that.
So obviously work, that makes sense. But
Yes.
if you've got a doctor's appointment or then you play community sport, do you need a new
permit? No, you would apply for the permit if and when you needed it, but it has a life for 2 weeks.
Okay.
So you only have to apply for a single permit. It's not a matter of every time you cross over the river you have to get a new one.
And I know
but if there's a form of words that's clearer than that, I'm more than happy to get them.
And I know the focus has been vaccines today, but you just said testing is also one of the most critical things you can do. You can't deny that the testing numbers are probably not as high as we'd want them to be. At the drive-through that I was at last night at Glenroy, there wasn't a single car at 6 o'clock. So are we doing anything to incentivise? Can we do testing blitzes for the local areas like we did last year?
Well, I'll put it to you this way. We've done 40, I'll just get you the exact number, 40,737. That's a pretty strong number. I haven't got the aggregate number over the last few weeks, but it's very strong. We're seeing it sort of smooth out a bit, so it's less of a dip on the weekends. We're not doing as they are in Sydney, and it's very important. Again, this is not a sense of criticism, but they've got certain postcodes where you can't leave the postcode unless you get a test every 3 days, whether you've got symptoms or not. We've not moved to that. We're doing, by and large, symptomatic testing unless you've been in an exposure site. But we've got 100% of all the Altaqua primary close contacts have been tested. Very strong numbers in all of our other groups that we're managing as part of our public health response. I think we've got adequate testing, but I would always encourage any Victorian, if you're asked because of where you've been, so as a primary close contact, to get tested, please come forward and get tested. If you've got symptoms, however mild, please get tested and please do it as soon as possible. I would never discourage people. The more people that get tested, the better, because it's the more complete picture we have. But I'm not concerned with those numbers. It's not like they're too low. And I would just guard against people, the natural comparison with New South Wales, where they literally are requiring people, whether they have symptoms or not, that have to go and get tested every 3 days. And it's I assume, many hundreds of thousands of tests each week can be directly attributed to that.
But even excluding New South Wales, the Burnet Institute put out a report this week that showed that behaviour in Victoria has changed when it comes to coming forward to get tested. A bit of fatigue there and a bit of a better understanding, maybe. But also, given that we are still seeing these mystery cases, great that we've got Altaqua locked down, but in terms of just those hotspot areas where wastewater testing and stuff is popping up, couldn't we do a blitz to just find it ASAP?
We're in furious agreement. We don't rule that out. If at some point we think that, like we in the past, we've literally gone door to door and put a testing site at the end of everyone's street. We've done it before. We would do it again if we thought that was something that would help us contain case numbers. We're not at that point now. There's lots of different reports from different research institutes. We look at all of those. There's no doubt that there's fatigue. Everyone wishes this was over. But arguably, the most important contribution that any of us can make is if we have symptoms, even really mild symptoms, please go and get tested as soon as possible. 98, 99% of results are back to the person the following day. Hopefully it's a negative, but if it's positive, we will support you. If while you isolate waiting for that result you're out of pocket, we pay you $450. There's every reason And I don't know whether other states are doing that, but it's something that we've done and we'll continue to do.
Why aren't we at that point yet?
Sorry?
When you said we're not at that point yet to put testing at the end of everyone's street, why aren't we at that point yet?
Because we don't have public health advice based on case numbers that justifies that. If and when, and I sincerely hope we don't get to that, because you remember the last time we did that was when we were doing some pretty intense effort in the north and the west of the city, and we had many, many hundreds of cases. That was at our worst moment in many ways, or on the way to our worst moment. We're in a different position now. But I just say to everybody, I know no one enjoys these rules, no one enjoys going and getting tested, but if you've got symptoms, the last thing you want to be doing is spreading this virus to the people you love, and indeed people you've never even met. So you can't ignore symptoms. If you've got them, then you have to come forward and get tested. And if you're out of pocket because of that, because you're doing a service for others, then we pay you $450. That, I think, is a good balance, and we've had thousands of people come forward and do that.
Given that there are a lot more mystery cases than there were during the last outbreak, isn't there a need to push for high testing in areas where there is a concentration of cases?
Well, we push for testing every day. We're not at a point where we need to be going door to door. We're not at a point where we need entire suburbs to come out and get tested. If we get to that stage, then we won't hesitate. I think we've shown, well, in fact, I know we've shown that we're prepared to do what has to be done, popular or otherwise, logistically easy or otherwise. We've done it many, many times, and we'll do it again if we have to. Mystery cases are always a concern. That's why genomics are important. There's a whole range of other testing, serology, upstream, downstream, that coronavirus detective work that's done. It's there for a reason. That's why we're so grateful to people who sit through interviews that can go for hours as we try and get a sense of where they've been, because that every little clue, every bit of detail helps us to put the jigsaw puzzle that is coronavirus together.
Can we ask the Cho some details on the mystery cases, please?
Absolutely.
Thank you.
Yes, you can.
Thank you.
Knock yourself out. There you go.
Professor,
I should say it's very early days for mystery cases in terms of details, but I'll do what I can.
just the Wyndham Vale delivery driver, do we know whether they were infectious and while making deliveries, and sort of roughly how many exposure sites that maybe?
Yeah, there will be exposure sites that come up from that case, as for all the mystery cases today. We've got a positive test result for that individual, so there'll be an assumption about the 48 hours before symptom onset and right up until the time of isolation that they were out in the community infectious.
The Western Autistic School in Laverton is now a Tier 1. So can you just explain to us, a student used the bus service, but it may not actually be the school that's impacted there?
That's right. So there's a concern about potential transmission on the bus, and those who are on the bus will be considered the primary close contacts. They'll have secondary close contacts, which will involve other students, other families related to the school, but it's not an exposure at the school site.
And do you know how many other students or passengers were on that bus service?
Not at this stage, no. But it's a relatively small number compared to a school being classified as a Tier 1 site.
How are you feeling about another day of multiple mystery cases?
Oh, look, it gives me some anxiety. I'm also calling out to everyone, especially in these locations, to get tested. We know that there'll be additional cases in Glenroy. There'll be, in all likelihood, cases in Wyndham Vale. There may well be cases in Truganina, Tarneet, because of these wastewater detections. So absolutely, people should come forward and get testing. In terms of the relative utility of that call-out versus a door-to-door testing program, we know that you are 50, 100, 200 times more likely to be positive if you've got symptoms and you're getting tested versus being asymptomatic if you haven't been identified as a close contact. So there is so much more utility in a message that says if you're symptomatic, headache, fever, sore throat, cough, whatever, come and get tested, versus a broad sweep of testing that would involve tens of thousands of people who've got no symptoms whatsoever. We do that surveillance testing where we've got a concern about people being at particular risk, but at this stage it's not of best use at a suburb level.
Considering those mystery cases in the last couple of days and today, is it 8 out of 15 have been in quarantine during their infectious period, so just over half? Do you think the situation is getting better, or do you think in fact it could still be getting worse?
Oh, look, there are two stories here. So for those identified chains of transmission, we're absolutely getting ahead of them. We've identified those primary close contacts and their household members and others. So, you know, the Altaqua cases, for example, that is wrapped around. We've got a lot of sense of security in relation to those and some of the earlier aspects of the outbreak. But every new mystery case, we're chasing it. Because it's just become known to us, and we need to identify their primary close contacts who will have been out and about, again, within a lockdown, but there are still essential workers, there are still essential reasons to move out of your home. So that generates exposure sites. So on the one hand, yes, we're getting ahead of aspects, but these mystery cases is exactly why we're calling out for vaccination and absolutely for testing.
And those 3 or 4 today that we have linked but weren't in quarantine while infectious, how is that happening now? Do we know what their connection is to other cases, and is it an issue that contact tracing hasn't picked them up before, and that's why they were still moving around?
Oh, look, there are a couple of reasons why people might become mystery cases, and it's not really a feature of contact tracing. If somebody hasn't checked an exposure site, don't know that they're a primary close contact, don't come forward for testing, go throughout an entire illness, maybe asymptomatic, maybe with very mild symptoms, never get tested, and they're out and about, and they pass it on to someone else. Well, that individual gets tested. That's our mystery case. But when they try and identify whether they've been in an exposure site, they can't, because they haven't. They've been in contact with somebody else who's never come forward for testing. So that's how mystery cases get generated, and that's why there's such a strong message for everyone who's symptomatic to get tested. The other reason why we might get a mystery case is because there's a new incursion into Victoria. Someone who's not declared appropriately, someone who's not been tested when they're symptomatic. We will do all the contact tracing when we know about cases, but we have to identify them at the earliest possible time, and people need to keep going back to those exposure sites and say, am I someone who should be getting tested here? Am I potentially a primary close contact, or should I get tested because I've been to a Tier 2 exposure site? They're really important messages.
Can I just clarify? I think Twitter said there were 4 unidentified cases today, and you've said 3 mystery cases. So which is the right number?
Oh, look, we can come back to you. Sometimes there's the original mystery case, and then they have a household member. So they're linked together, but they're all part of an unlinked cluster, if you like.
And just a question on a broader public health issue. We're getting reports that parents are really struggling to get their kids outdoors and active during the 6th lockdown. So what's your advice to them on that? And while you're dealing with the public health bushfire, do you have an eye on, once that's out, how to deal with the consequences of all of these lockdowns?
There'll be so many consequences, short and long term, out of this. It's a global issue, and every country will be struggling with this to one extent or another. I know that if we don't put out this bushfire now, we are dealing with longer and harder and more disruptive and more damaging circumstances for everyone. So we have to do what we have to do to drive this down and get beyond it. How we respond to all of the challenges out of this, we'll take advice from our chief psychiatrist, from Patrick McGorry, all of those who understand the mental health challenges and all of the consequences for kids, for the elderly, for those who've been particularly isolated, and take actions on the advice of those experts. But there's no question there'll be a challenge ahead of us. For kids who are home now, and I've got my 3 doing homeschooling, and for some of them they kind of roll with it. For others it's clearly a challenge. So I accept that there'll be so many families who are struggling with this in one way or another, and kids who are particularly struggling with it. Some who, for whatever reason, find their groove and can do online, can find their rhythm and space at home, but a lot who won't. I would say try and create a school environment at home to the extent that you can. And I know there are working parents who are at home trying to juggle all of this. It is not easy. But my kids get in their school uniform at home. They have their scheduled times to get on their WebEx call with the teachers and meet their class. My wife tries to get them to have some outside time, some craft time, some whatever time. Having that kind of rhythm that is a bit like they would have in school, I think is part of that solution. But I'm not the teacher and I'm not the expert here. Schools are reaching out to families to say, if you are having struggles, please contact us. If you need advice from us, if your child has a particular need for that one-on-one conversation with the school, please make that happen. So I would reinforce that message for all families who've got kids home at the moment to reach out if they've got particular concerns, particular challenges to address.
How concerned are you about the South Melbourne market?
Look, any exposure sites are a concern. A lot of people move through these places. We've had markets exposed before without cases occurring. Sometimes there's good ventilation, sometimes it's not so strong. Sometimes there's a very infectious person there, sometimes not. Again, everyone who's been there as an exposure site should be getting tested and following the advice online. But yeah, big numbers of people, and there's always concern about potential exposures there. Oh, we'll get the QR code data through the course of the day, but hopefully, we can chase that down, but also use this platform to be able to let people know, because not everyone necessarily QR checks in. We'll reach out to those where we've got details, but otherwise, please just follow online to understand if you're there at the relevant time.
If we hit the 80% in your mind as a child, will you be going back to rolling lockdowns if we get another variant or another form coming in?
We have to see what 80% delivers us. The modelling is great, and we are confident that it'll change the landscape of how we need to respond to stuff. But to the point about what another variant will bring us, that's an entirely unknown proposition. I hope that we don't get anything remotely like a Delta variant into the future.
I mean, is there something you're willing to accept as a new normal for as a professional? I mean, not just for Victoria, globally, do you think about these things?
Oh, of course. It's not just for me to make that decision. It's a national conversation. It's a determination of civil society about what we're balancing here.
I'm seeing in Europe, for example, there's various different types of baseline. I mean, right now there's people travelling. I've got colleagues going to Greece and vice versa from America, and they've got much higher rate of infection and higher rate of vaccination as well. So at what point do we become a hermit kingdom? Do we change it? Do we shift our position in terms of what we expect and not?
Well, I think there will need to be a shifting expectation, because we've had an aggressive suppression strategy, which is entirely appropriate, which has served us very well. I don't want us to be the Florida that the Premier referred to, with 16,000 people hospitalised, the greatest number of children hospitalised at any point in the pandemic.
Can we be the New York, for example?
Well, New York's also got challenges, but I accept that the higher the vaccination rates that we can get to, the greater the freedoms that we'll be able to enjoy. I don't, however, want us to move to a place where we've got 130,000 people who've died like the UK has. Yes, they are moving about more, and they should rightly think about being able to live differently with high vaccination coverage. But we have to think about long COVID. We have to think about our kids' health, what it means for our hospital system. So we need to see what 80% will deliver us. I absolutely hope and expect that it doesn't mean lockdowns in the same way. What it means for international movement across the country, to be determined. But I would, again, expect that we'll have greater freedom to travel interstate, and we are all looking to be able to see friends and family overseas and take holidays. So I hope it delivers that as well.
Could lockdown still be a feature of Victoria's public health response
well,
post 80% vaccination?
Not what the modelling is telling us. Modelling is not a rock-solid prediction of the future, but if it is right, and if it turns out that that's what 80% vaccination coverage of our eligible population delivers us, I fully expect that we don't have to go to lockdown.
Even with the New South Wales outbreak at the moment?
Well, the New South Wales outbreak will be a challenge for New South Wales. Our border management is what will protect Victoria, and if we've got very low case numbers or no case numbers and we get to that high vaccination coverage level, then lockdowns shouldn't have to be a feature.
So we could still have our border closed to New South Wales at 80% vaccination?
I don't want to jump ahead to that because we're not there.
Sorry, Premier, just one non-COVID related question.
The issue in relation to the border, that's a lockout. That's not a lockdown. and that'll be there for so long as we believe Sydney, New South Wales or any other part of the country or any other part of the world. That's essentially why our borders are closed. That's why we're doing quarantine. That's why we've closed our borders at a domestic level, because the case numbers are too high.
I think at the start of this press you said if people want to participate fully in 2022, they'll need to be vaccinated. What do you exactly mean by that, and what sort of activities will people need?
That's not yet determined. So National Cabinet has tasked both Victoria, Tasmania and the Northern Territory to lead some work. There'll be some discussion of that today. That's by no means finished. Will
the state government mandate a new vaccination passport, or leave it to businesses or event organisers to decide whether?
Again, that's not finalised either. And I suppose this is a difficult conversation to have with people now in an almost kind of threatening tone, when people who want to get vaccinated can't because we don't have enough stuff. There will come a time, though, where I think restrictions will apply to those who have not been vaccinated, rather than restrictions applying to all of us. Now, if that's not an incentive to go and get vaccinated, I don't know what is. But I can see a time when to get into a venue, to attend a major event, to participate fully as a customer, a client, a ticket holder, a patron, a viewer, however you want to look at it. Being vaccinated will mean you get in, and not being vaccinated will mean that you don't. And some people will be all up in arms from a civil liberties point of view. Well, that's not the issue here. The issue here is keeping people safe. And there will be a percentage of the community who cannot, for medical reasons, be part of the vaccination program. We'll need to make sure that they've got a passport of their own that demonstrates that they haven't chosen to ignore the advice. They can't be vaccinated. Then there'll be a whole lot of people, hopefully 80+% of people who have got the jab for themselves and for everybody else. And then there'll be a small number of people who choose not to. I would commend to everybody that these vaccinations have been through a rigorous process, globally significant rigorous process. Getting vaccinated is not just how we get to the other side of this, but getting vaccinated is how we save lives.
Sorry, Premier, just on a very local issue.
That's fine.
Frankston residents are wondering whether developers who plan to develop a $90 million high-rise on Davey Street will be stopped from demolishing heritage buildings or properties.
Well, there's a planning process that needs to be run by the local council. There's a well-established heritage process that's much more about the state government and trying to protect all of our history and our heritage. We take those matters very seriously. I think it's far too early to be saying what will happen on that site. But there are processes to go through, and those processes are rigorous, as I think everyone in Frankston and indeed right across Victoria would want them to be.
Sorry, I know I'm a broken record on this.
No, that's all right.
Are you prepared?
I've been described that way myself, actually, but that's all right.
Are you prepared to keep up the border closure with New South Wales when we've hit 80% vaccination in Victoria if their outbreak doesn't come down?
We'll have to look, and I don't want to be a broken record in kind of not answering your question. Some questions you can ask them many, many times, doesn't mean that I'm any more able to answer
Surely
them.
You've had those conversations.
No. To be clear, to be clear, I've not had a detailed discussion, and we certainly have not made a decision about what border controls look like when we're at 80% and say New South Wales is at 80%. I would hope no one's shocked about that, but that is a long way off. That's not weeks off, that's months off. And we would look at the conditions on the ground before. I really can't speculate. What I will say, though, in broader terms, is that we'll do what keeps Victorians safe, whether it's popular or not. That may involve having to say no to a lot of people who want to come here and want to come here for the best of reasons. But again, the more of us that get vaccinated, the more likely we can have no border restrictions to any state in our nation, and indeed very few, if any, border restrictions to the rest of the world. That's what we're all working towards. But unless we get the vaccination numbers up as high as possible, then we'll always have to have some rules in place. We want it to be very different.
Premier, you've had discussions, I'm sure, at National Cabinet about migration. I mean, we are a migration nation economically, and there was some discussion in the Commonwealth that they're expecting 1 million migrants once we get to a vaccination point by 2030. And Victoria depends on migration, as you said before. What's your vision for that? I mean, you still expect migration, don't you?
At some point there will be, but they're not matters for. The way I've always approached this is that, if there's a proposal on the table, then I'll give you a comment on it. But I don't do migration policy. I don't issue visas. That's a matter for the Commonwealth Government. And there are many other things that they don't do that are matters for us. So if we all play our part.
Victoria depends on migration, of course.
Well, hang on a minute. Victoria depends on many different things, and migration, international students, the free movement of people rather than their migration status, but the free movement of people, that's very much in our interests, very much in our interests, and we've always been supportive of that. But the Commonwealth Government, no doubt, will be spending a lot of time thinking about who can come here, and whatever limitations, the rules around them coming here and when. All of that's principally a federal matter, and no doubt there'll be a discussion and a debate, because there'll be lots of different opinions about that at the time, but it's a little bit early for us to be talking about that.
Just to check, earlier you said if you had to put further authorised officers up at Sydney Airport, you would. We don't already have authorised officers there.
We've got some people there. What I'm saying to you is we're happy to look at. Don't get too bogged down in the absolute specifics of what powers and all those sorts of issues. What I'm saying to you is the point I'm trying to make, and if I haven't made it clearly, let me try and make it clearly now. We'll do whatever we need to do to keep Victorians safe and to defend the permit system that we have in place. If, however, people are determined to do the wrong thing, well, then they might make their way here, but they won't get much further. They'll spend a couple of glorious nights in hotel quarantine and then they'll be sent back. I can't charge them, I don't think, for their hotel quarantine because they're not residents of Victoria. They're not international quarantiners. If I could, I would, but we can certainly fine them, and I think we've demonstrated that we will, in fact, do that. The permits are there to keep everyone safe. I know it's incredibly heartbreaking to have to say no to some people who genuinely want to come here for the best of reasons, but that's the system we have in place. If we had that border open, if we had a freedom of movement, then we would have not a handful of cases from New South Wales. We'd have hundreds of them. Look at the way it's spread, Dubbo, Wagga, Byron, all across to the west of New South Wales. Like, if it can get to Byron Bay, only a fool would think it couldn't get to Albury. We've got that border shut for a reason, and I just ask people to respect that. Trying to cheat your way into Victoria is not smart, and you will get caught and you will get fined, and we will do whatever we have to do to defend that border and to keep Victorians safe. And whether people like the sound of that, I don't really care. That's what we're going to do. Because if we have freedom of movement, we'll just have cases. And we'll finish up like New South Wales, where I'm not standing up here talking about a handful of cases and every likelihood of being open. Instead, we'll be locked in till we all get vaccinated, and we have thousands of cases, not single figures, thousands of cases, and our hospitals full. We don't want that here. We don't want it in New South Wales either. Any other issues?
In terms of spreading the vaccination message, in your tweet you spoke about selfies. Have you thought about enlisting influencers?
I'm sure somebody has. I'm sure somebody has. Oh, look, to be honest, this is such a personal thing that I think everybody can influence the behaviour of others. I've gone and got two shots, so's Kath. Every family has an interest in doing this. Every family should do this for themselves and for every other fellow Victorian, for the best of reasons. And sometimes a grandson or daughter having a conversation with grandpa or grandma, that might be the most powerful influence that you can possibly exert. Go and get vaccinated for me. Go and get vaccinated for yourself. Go and get vaccinated for every single Victorian. Go and get vaccinated so we can have different rules, and very few of them. Get vaccinated so we can be open and resume our jobs plan and the really strong economic performance that's been a hallmark of most of this year. Any other issues? I thought you might have given me a list of proposed influences then, but that might have got a little bit tricky. If there's no other questions, we'll see you again soon. Thanks very much.